Hi, everyone. Welcome. I want to thank you so much for joining to learn more about our foster program, and specifically, we'll be focusing on talking about kittens. My name is Dr. Clarissa Funke, and I am the Veterinary Programs Director at Michigan Humane. This is going to be a two-part series. In this first part, we're going to be reviewing our foster program and how everything works. And then we're going to be diving into a bit more detail about graduate and Gerber kitten care. Those are our older age kittens. And we're going to talk a little bit about health and wellness in the different groups. And then for part two, we'll be talking about all things bottle kitten and nursing kitten related. So when you sign up to participate in our foster program, you can really access our foster list, which allows you to foster any species or age of animal that we have available. We do have a particular focus on kittens, though, and that's because the kitten program makes up 36% of our foster animals. The shelter deals with something called kitten season, which refers to the time of year that we're swamped with kittens. This starts in March, and it usually peaks around July, August, and then tapers off around October, November. 8 weeks is going to be the magical age when kittens are large and healthy enough to be able to safely undergo spay-neuter surgery and go up for adoption. And if they come in younger than that, they're sort of stuck in the shelter, and the shelter is not a great place for young kittens. Crowding, especially when we're getting a lot of kittens at once, can make it really difficult for shelter workers to notice individual illness, as kittens can kind of appear lost in the crowd. And we just can't replicate the same quality of socialization and care that an individual home environment can provide. We're trying to prepare them to be someone's future pet, and the best place for them to learn how to do that is in an individual household. Shelters can also really be a lot like daycares, and young animals with immature immune systems in a concentrated space can lead to the spread of contagious disease. So when you sign up to foster with Michigan Humane, we're going to provide you not only with the kittens, but all of the supplies, training, and support you might need, as well as all the medical care through our veterinary team at Michigan Humane. As a foster, your primary obligations are going to be to provide them with a safe place to grow, make sure that you're being attentive to their needs, and just be available to come in for veterinary appointments as needed. Once you sign up, there are several different ways that we're going to communicate which animals are available for foster. Our general foster program is going to send out a daily email with a list of all animals, a description, and the reason for foster. The foster program for kittens also relies on something called Foster on Deck. So this is going to be where you fill out a survey, and when you fill that out, what you're indicating is that you are ready to take home kittens as soon as they become available. So we keep a running list, and as soon as kittens come in the shelter, we'll give you a call when we have kittens that meet a description of what you're comfortable taking, and hopefully you can come and pick them up the same day. If we don't have anyone on our Foster on Deck list, we might also post urgent requests on our private foster Facebook group, which you will get an invite to join once you sign up. Now let's move on, and we can talk a little bit more about the kittens themselves. So at Michigan Humane, we divide kittens under 8 weeks of age into 3 functional groups. And these are sorted by developmental milestones, mostly what they're eating in their diet, since this is largely going to determine the level of care that they're going to need. While it does correlate with age, just like human children, kittens don't always hit developmental milestones at the exact same time, so there is a bit of overlap between groups. So the youngest age kittens that we have are going to be bottle kittens, and those can be anywhere from 0 to 5 weeks of age. They're unable to eat solid foods at all, and they're strictly bottle feeding every few hours around the clock. They need stimulation to go potty, and they need an external heat source. Our transitional age kittens we call Gerber kittens, and these are kittens that are weaning onto solid foods, but they need some sort of assistance, even if it's just softening the food into a more gruel-like mixture, because they're not completely ready to eat solid foods on their own yet. There's a lot of variation in the level of development in this age group. Our graduate kittens, the oldest group, are going to be anywhere from 5 to 8 weeks of age. These kittens are independent in most ways. They're eating normal kitten food without assistance, and they're a great starter kitten for new fosters. So first we're going to talk a little bit about graduate kittens. Some of the best things about fostering this age group is that these kittens are far more independent, and they can be really fun because they're in a heavy play developmental phase socially, and they're also very hardy, so you don't have to worry quite as much about them. Some of the drawbacks to fostering this age group is they can be a little bit crazy sometimes because they are in that fun play phase, and it's really variable between litters, but some of these litters can be messy, especially if they're kittens that like to play in their litter. In terms of housing, we do recommend keeping foster animals separate from household pets, especially for the first 2 weeks to minimize the risk of contagious disease. So for this age group, it's really best to have a separate devoted room. Spare bathrooms, a laundry or mudroom, or even a spare bedroom could work. Additionally, a benefit of having a devoted space for kittens is that by controlling the area they have access to, you can ensure that the area is kitten-proofed. This means that you can look at the space for safety concerns like wires, toxic plants, and areas that might pose a danger. Another consideration when you're looking at what could be your potential foster space is the cleanability. So you want surfaces that are going to be easily disinfectable and washable or disposable coverings. We do have some fosters that do use carpeted bedrooms, but we can show you on the next slide how they've made adaptations to that space to make it work. So here are two examples of foster setups. The left picture is a hard surface floor, which is going to be great to be able to wipe that surface down afterwards to kind of clean and disinfect it between litters. You can see that this foster chose to use some of our modular dividers to keep the kittens from accessing other areas. And these are supplies that we can provide you for our foster program. Sometimes we do run out of some of the playpen related things, but a lot of the times we have them available for your use. What's nice about using these dividers is it provides access to all the things that they need, but keeps them out of the areas that could potentially be dangerous for them. And they have enough space that they can have separation of resting, playing, eating, and bathroom activities. The picture on the right is a picture of a foster that has a carpeted space. However, underneath all these blankets that you can see laid out, they do have a plastic tarp layered underneath. So if there's an accident in their home, they can just pick up the towel, wipe down the tarp that's underneath, and kind of lay down a new blanket or cover. And then that allows that space to kind of be easily cleaned if they choose to take another litter later after they've returned these ones for adoption. So in terms of feeding graduate kittens, these should be easy peasy most of the time. Most of them are eating independently at this point, and you just have to provide them with wet and dry food, and they sort of do most of the work on their own. We do still want to make sure we are monitoring their appetite and body condition, because we want to make sure that, especially if you have like litter, it can be difficult to see if one of the kittens is maybe starting to develop a little bit of illness. They can kind of get lost in the crowd. So if you do have a kitten that is struggling with appetite, there are a couple of easy things that you can do in the beginning to try and help. Some kittens and adult cats are picky eaters, and some of them have a strong preference for just wet or dry food. So making sure that you're separating the two, because some cats will not eat them if they are mixed together. We can also try and stimulate their appetite by offering other flavors and textures. And then kittens with upper respiratory infections specifically may have a loss of smell that affects the appetite. So in those cases, heating up the food in the microwave for just a couple seconds to make it warm can also really aerosolize the smell, making it easier to identify the food for cats. And then choosing stronger smelling flavors like fish flavors can help a lot too. Another thing that we occasionally see is some kittens that come to us in not the best condition in the first place and have some muscle loss because of general poor body condition can also have weak jaw muscles, and that can actually make it difficult for them to chew. A lot of times what you may see with those types of kittens is that they're trying very hard to chew out of the side of their mouths, and you may hear an actual like grinding noise of their teeth as they struggle to chew. So you just want to make sure that you're watching those kittens closely to make sure that they're not sort of just chewing on the food but not able to chew it to a point where they're swallowing it, because sometimes it can appear like they're still eating, but they're actually not. If you've tried sort of all these straightforward first things, our medical team is definitely available to help with kind of the next level of care. We do have appetite stimulants and other supportive care items that we can prescribe. And if you have a kitten that's really struggling, a lot of the times we will take it back into the shelter for a few days to provide extra support with our medical team and get them in a better place before we send them back to you. Here's just a picture of some of the other like flavors and types of foods that we have available for kittens. So if you have a kitten that needs other types of food because they're struggling with their appetite, you can always just call us and we will provide you with other types of food that you can try. And here's a picture in the shelter. This is how we separate our wet and dry food for kittens. Another thing that's really important to note about this picture is you can see how the wet food gets really pressed down into the plate when they're eating it. And sometimes when it gets that pressed down, especially if it's one of those kittens that we mentioned that might be having a hard time chewing, actually just fluffing the food up again so that it's kind of easier for them to grasp without having to shove their face so hard down into the bowl can help a lot. The majority of graduate kittens don't typically have those eating problems. The majority of the focus with graduate kittens, a lot of times it's going to be socialization and behavior because this is an important developmental period for them. So there's two main types of kittens that we see. We have the wild kittens, which are not scared of humans at all and are super social, but sometimes can almost be too hard or overzealous in their playing. And it's all going to be about making sure that we are teaching them how to be appropriate kitten citizens so that they'll be good adoption candidates. So if you have a kitten that's playing too rough, making sure that you're redirecting them from their hands to toys that are appropriate to play with so that they don't learn that it's acceptable to bite people. When a kitten is playing positively, we're going to continue to play with them that way. That's a form of positive reinforcement. So you're continuing to do the thing that they like because you want to reward that behavior. And then negative punishment can sound bad, but I promise you it's not as scary as it sounds. So all that means is that you're withdrawing something that they like, or rewarding thing to decrease a behavior. So in this case, it would be removing your hand if they're enjoying biting that so that you can decrease the behavior of biting. So they learn that if they do something that they're not supposed to, that they don't get to do it anymore. Now with shy kittens, it's kind of a different approach. We're just trying to build positive associations with people. That's the other type of kitten that we definitely see a lot of in the shelter. So those are kittens that maybe came from outside, didn't get enough time to be able to spend with humans to learn that they're going to provide care. So just spending a lot of time with them in their area, making sure feeding can be a really positive interaction for kittens. So if you have a food motivated kitten, making them have to eat the food while you sit near the food bowl just teaches them to associate you with the positive experience of eating. Gentling is something that sounds like a made up term, but it's not. It refers to kind of talking to kittens in a baby voice, using quiet, gentle movements and interactions with them to kind of encourage them to have a positive experience. If you have a kitten that enjoys being groomed, grooming them, we have disposable toothbrushes that we can provide as like nice little brushes, even for very little kittens, can be a really positive experience. These types of interactions are going to need to be frequent because honestly, a lot of times you can spend 10, 15 minutes with kittens. They may start off very fearful, and by the end of the interaction, they're acting like they've accepted it and kind of moved on. And then you go in the room a couple hours later, and they act like they've forgotten that ever happened and you're scary again. So it really needs to be repeated frequently, and they will eventually kind of retain that information. It's important to remember that shy kittens can have a lot of noise aversion, so trying to minimize loud banging noises and stuff like that in the background can really help a lot too. Now we're going to talk a little bit more about Gerber kittens. The pros to Gerber kittens is compared with the bottle babies, there's no nighttime feedings with this group, so that is really nice. And in my opinion, Gerber kittens are the cutest age of kittens because they're just peaking in terms of cuteness to me. The cons to this group are definitely going to be that this is like the messiest age group of kittens. They will need a bigger space than neonates, but they will need a less big space than your graduates. And this age, because it's a weaning phase, tends to have a lot of like GI upset associated with it compared to the other ages. So they do have a bit more health struggles than like your graduate group. When it comes to feeding Gerber kittens, there's going to be a lot of variability in this age group. And I think it's really important to remember that all these kittens are unique. So we try and meet them where they're at. I always remember this one group of fosters that we had, and they had been started from the time that they were like bottle kittens. The foster had had them until they were about 7 weeks of age. And she was planning on a vacation, and all the kittens had completely weaned onto dry food, except for one kitten that refused to give up the bottle. And so she was asking me if I would take her kittens for the weekend just because she had this vacation planned and she expected the other kitten to be weaned a lot sooner. But I always think that's such a funny story because it just really illustrates how occasionally you can just have one kitten that just is not following the plan, and you just have to be able to be flexible and kind of adjust to what that individual kitten needs. So the majority of these kittens are going to typically be eating something called gruel, and that's a mixture of canned food that's been softened with either kitten formula or water to make it easier for them to consume because they haven't quite figured out how to chew a lot of the times. You may be able to, for some kittens, to just put this in a bowl, put it down, and they can go to town on it. But other kittens might need even more assistance, like hand or syringe feeding. We want to make sure that when we're using gruel, that we're changing it frequently and that we're not leaving it out the entire time between feedings, because it can, especially when it has so much liquid mixed into it, kind of spoil or go bad if it's left out for so long. And frequently, these kittens require bathing either after every meal or at least once a day, maybe with like intermittent wipe downs in between. And this typically the reason why we call them the messy group. And as you can see here in this picture, they really like to like stand in the food and kind of walk through it so it gets all over their fur. And that's where a lot of the messiness comes from. So as I mentioned a little bit, some kittens may need additional assistance beyond just providing gruel. So kittens with mothers would learn how to eat solids by observing the mom and watching her eat food, but orphans don't have this opportunity. So some kittens, especially those transitioning from bottle feeding, may have learned to associate hands with feeding, but not bowls. So you need to use your hands to kind of guide them to the bowl. And similar to socialization, they can kind of forget even if they seem like they've gotten it during a certain session, and you may have to repeat this process for several days. Some of the kittens that we talked about that might have like chewing problems can have super liquidy food fed through a syringe if they're having a hard time being able to grasp the food themselves. But if we had a kitten that we needed you to take to do that, we would like give you a demonstration in person on how to do that beforehand. So I do have a video here just to kind of show you what the hand feeding process can kind of look like. Now this kitten was suffering from conjunctivitis. So part of the problem I think with him is that he can't really see or smell the food very well. But it's the same sort of process. He can kind of figure out when the food gets to his face that he's supposed to eat it, right? But he can't really find it on his own and get to the bowl. So it's just kind of like putting the food on your hands or, a spoon or stick and sort of showing them what it's all about until they eventually get it on their own. And he does eventually come to the conclusion that the bowl is the right place, but it always takes them a little longer than you think it should. There we go. And see, now we kind of got him to the place that he needs to be. But you just have to be patient and it takes time. And you can see how they kind of just get it all over themselves, which is why they always need baths afterwards. In terms of bath, it's probably a good idea to kind of just talk about what that can involve. Sometimes, if they're not completely just soaked in gruel, you can get away with using a wet wipes or baby wipes, which we do provide a lot of times in the supplies to wipe down their paws and face. But if they really are getting it all over them, or at least once a day, we're going to give them a bath. And we want to use something like Dawn dish soap or like Johnson's & Johnson's baby shampoo to clean them, something that's really mild. Some of them may need a soak, like this really cute little foster kitten here. Other ones you can kind of just rinse down, holding them kind of under the faucet. You do obviously want to check the temperature of the water, make sure that it's not too hot or too cold. Never directly put water on their face. We're either just going to use a damp rag or something like that to wipe down their face pretty gently. And then we want to make sure that we're trying to provide them with extra heat support after a bath so that they don't get too cold. Because even though they're of weaning age at this point, and under normal circumstances, they would be able to maintain their body temperature. That doesn't really hold true when they're wet. So there's a couple different ways that we can dry them off after a bath. We can just towel dry them and make sure that we're providing them with an external heat source, like a heated up water bottle wrapped in a towel, or we have these things called snuggle safes, which are heating discs that can be microwaved. Cover that in a blanket and it just kind of gives them like a warm heating pad like situation to cuddle with. If you want to use a hair dryer, you can do that. We just really want to be careful not to cook the kitten. So when we do that, we put the temperature on the low setting for heat and on the low setting for how hard it's blowing. And then what you would do is you would always keep your hand in front of the kitten and just kind of let the air blow around your hand, because you can feel on your hand, if your hand is starting to get too hot in front of the hair dryer, then the kitten probably is too. So we just use caution if we're going to blow dry them. In terms of housing, a lot of different housing setups work for Gerber kittens. In terms of the enclosure size, a lot of times you might want a little bit smaller space than you would use for the graduate kittens, because you want to make sure that it's easy for them to find things like the litter box and the food bowl, whereas older kittens might have an easier time doing that. When we're setting it up, we also want to consider accessibility and the height of everything. So these kittens are littler than graduate kittens, so sometimes they need low-sided bowls and litter pans to be able to get in. If you have a very young Gerber age kitten, like around the 3 to 4 week age, and they're just starting to use the litter box on their own, a lot of times just a paper plate with a little bit of litter in it is enough for a litter box in those situations. If you're keeping them in a cage type setup, We do recommend using either guinea pig or rabbit cages rather than like a dog crate situation. And that's because the bars are a little bit narrower, so they're unlikely to get stuck in those, where I have seen kittens be able to either squeeze through or get their head stuck in between dog crate holes. So here's some examples of other foster setups for Gerber kittens. A lot of our fosters are big fans of the pop-up tents, and we do have these available to borrow as part of our foster program. They can be disinfected by soaking them in the bathtub with disinfectant between litters, and we do provide you with disinfectant as well. These are nice because they're also portable, so if you have a work situation where you were allowed to bring foster kittens, which some people do, you could bring it to different places with you, which is also very nice. But you can see there's room for litter, food, all those things, but it kind of keeps them a little more closed in than the graduate age kittens. They're not really running around and super wild at this age. Anyhow, they're more like toddlers that sort of toddle about. So it just keeps everything a little bit closer together. And then this last one you can see is a little bit bigger setup, but still kind of limiting it to a closed space. Again, we're using those modular kind of barriers in this one. And I like the use of pee pads on this, really helps keep it clean. So now we're going to move on from talking about Gerber kittens, and we're going to talk a little bit more about health and wellness issues in kittens. So as a foster, you should be prepared to be coming in for appointments for a healthy kitten every 2 weeks. And at those appointments, what we'll do is we'll be boostering their vaccines, giving regular dewormers, and monitoring their weight as part of their wellness schedule. Assuming that they're remaining healthy and have gained approximately 2 pounds, at about 8 weeks, you'll schedule a return appointment where you can bring the kittens back to the shelter to be spayed or neutered and go up for adoption. While kittens are in the shelter, they're going to already go through a health screening before we send out a foster request on them. If we find any conditions that we know at the time that we're sending out the foster request, we'll disclose those. The most common one would be upper respiratory infections and conjunctivitis, which is similar to a cold in humans. Occasionally we have kittens that will come in poor condition because they've been orphaned and kind of out on the streets for a while. So sometimes weight gain may be a particular focus of them getting into foster and making sure that they're getting really good nutrition. And sometimes we have kittens with like wounds or injuries that may need treatment. When you pick those kittens up, any medications that the kittens will need will come with them. And on the next slide, I have a video of a kitten getting some oral medications to show you that it's typically not too hard to give those. Most of the medications that we use in kittens are going to be either 1 or 2 times daily, so should be compatible with most people's normal schedules. While we do everything we can to ensure that we have identified any kind of health conditions before they go to foster, kittens can still develop issues once they go into foster. Again, because they've been in a shelter situation, contagious disease is always a concern, so sometimes they break with the colds or the upper respiratory infections once they're in your home, so keep an eye out for sneezing and those types of things. GI issues, diarrhea, weight loss are all things that we monitor pretty carefully for and try and stay on top of treating. And we want to also keep a close eye out for any hair loss. And we're going to talk a little bit more in detail about all these issues. The one thing I would say with kittens is that you want to make sure that you're really being proactive. If you're identifying that the kitten might be sick, it's always better to call us and make an appointment sooner rather than later, because kittens are so small. When they start to develop health problems, they can kind of escalate quickly. So when you have a larger animal, or even in yourself, if you're feeling under the weather, you might wait it out for a couple days to see if you recover or if your animal recovers on their own. But in kittens, we'd rather get them started on treatments right away. And while this is a younger age kitten, I just wanted to include a video of showing what it looks like. Most of the medications we use in kittens are going to be liquids, so it's a pretty easy process to be able to medicate them in your home. So see, you just put hands on the side of the mouth, squirt it in. It's usually a very small volume of medication, so it's not too hard. So, as I kind of mentioned a little bit, weight gain issues are one of the more serious things that we're concerned about with kittens. And that's because kittens are so small in the first place that when they are struggling to gain weight or are losing weight, they can become dehydrated or thin so quickly that it's really important that we get on top of these kind of health problems sooner rather than later. Typically in kittens that are struggling with weight, we're going to see it either happen as a result of an appetence. If the kitten's not feeling good for other reasons, that can certainly affect their appetite. And then we do see a fair amount of diarrhea in kittens because they're so young and their GI tracts aren't quite as strong yet. calories out and, fluids out can lead to dehydration and weight loss pretty quickly as well. In terms of diarrhea, there's three main causes that we'll typically see. The first is a weaning age diarrhea. So this is most common in those Gerber age kittens. And that's because a lot of the times they're just transitioning to those diets in a different way than they would if they were with a mother and they weren't orphaned. Typically, kittens would nurse on a mother until they're a little bit older, around 6 weeks of age, while they gradually introduced other diets into their food. When we see it in kind of an artificial orphaned way, we typically have to transition them all onto a new diet at once. Because they're getting to the point where they would chew on a nipple or something like that, and we just can't give them bottle formula anymore. So definitely a dietary component to it. We can also see bacterial and viral causes of diarrhea. Bacterial is typically, again, kind of like a side effect of gruel a lot of the times. When you're mixing in like a milk-based formula to their diet and adding that much liquid, it can tend to spoil if left out for too long. And also because they tend to walk through it and stuff like that, it gets kind of dried out on their fur, and then they try and clean themselves and groom their fur up, and they can get the bacteria in their GI tracts that way as well. And there's a lot of like minor viruses that can cause like transient diarrhea in kittens. There is one of like more serious concern called panleukopenia. If you don't know what that is, it's very equivalent to kind of parvo in puppies. It's not super common. We only see a couple cases of it every year, but when we do, it can be super contagious and it can be somewhat deadly. Most kittens that get it are either pretty sick or they can pass away. So because of that, we try and screen very carefully as much as we can predict or identify this and not send those into fosters, but occasionally we do have one break in a foster home. If that's the case, we will have you take a break from fostering or walk you through very carefully how to disinfect your space depending on your situation, because this is a virus that can live in the environment even after that kitten has been treated or moved on. That is always unfortunate if someone's really enjoying their fostering experience and kind of has to sit the rest of the season out. For all other causes of diarrhea, we can prescribe medications and supportive treatments to kind of help them through that. But there's a lot of things you can do in terms of nursing care at home as well. So we do still recommend feeding through diarrhea because we do need them to be taking in enough calories. But we can send you with bland diets and probiotics and things like that to kind of help. We just want to make sure that we're still meeting their fluid and calorie needs. And then just, keeping them clean. They can get diarrhea scald just like babies get diaper scald. So making sure that, we clean that area, that we're bathing it if they're having whoopsie poopsie blowouts, and keeping the area, make sure, especially in long-haired kittens, that fecal matter isn't getting trapped in the hair around the rectum, because that can cause some fecal matting that can also cause a really bad rash. So just making sure that we're checking under the tail pretty frequently to make sure that they're staying clean under there. We also see a ton of upper respiratory infections in kittens, and that's kind of like a typical shelter disease. It's just hard to avoid. Shelters are very much like daycare situations. The symptoms are going to mimic very much like a human cold. So sneezing, congestion, nasal discharge. Some of them are pretty mild. Other ones are more severe. One thing that we see a lot of the times is that if they're congested or they have enough nasal discharge, they may have a difficulty maintaining their sense of smell. And they do need their sense of smell to eat. So we want to make sure that, we're doing what we can to keep their appetite going. I know we talked on a previous slide about heating up their food and choosing smelly foods to make sure that they're able to smell as much as possible. Also, we can do things like steaming them in your bathroom. You can turn your shower on, get it nice and hot and steamy, and then let the kittens kind of hang out in the bathroom, not inside the shower itself, for like a half an hour to an hour. It will make them feel more comfortable in the same way that taking a nice steamy shower makes you feel more comfortable when you have a cold. We can also do things like saline nasal drops to help break up some of the congestion that they may have. Oftentimes we'll see upper respiratory infections also associated with conjunctivitis because they're caused by the same viruses, but they don't always have to go together. And we'll talk more about that on the next slide. If you do have a kitten that develops an upper respiratory infection while you have it in foster, give us a call because there are medications that we can prescribe to help them with that. And if you're picking up kittens that we already know have upper respiratory infection and have been prescribed medications, we'll send those with you at the time of pickup. So this looks like a pretty typical case of conjunctivitis that we'll see in the shelter. As I mentioned, these oftentimes do go along with upper respiratory infections, but you can have just one or the other. Some kittens can have really mild cases with just squinting and maybe like a CPI, and they may not even warrant treatment if they're super mild. But if they have crusts and stuff like that, we will typically want to prescribe medications for that. Oftentimes the crust can get bad enough that the eyes can be crusted shut, so we want to make sure that we're just kind of keeping those eyes clean and removing those crusts with like warm water and warm compresses and gently opening the eyes if we find that they are crusting shut when they're sleeping. There are certainly a lot of different medications that we can choose to prescribe for this, both oral medications and eye drops, so that wouldn't be uncommon. We see really severe ones and we see very mild ones. Typically, if it's something that's really severe, those are not ones that we would necessarily send a foster request out, because we're going to try and manage those in-house as much as we can with closer supervision. And then the last one that I want to talk about, skin and hair conditions in kittens, I wouldn't say are super common. By far and away, the most common one that we'll see is a gruel rash. You saw those previous pictures of kittens kind of walking through the gruel. If that isn't rinsed off kind of immediately, it can certainly harden in the fur and dry and cause kind of a rash along the areas of the body that is happening to super frequently. We can also see fecal or urine scald. Fecal scald typically in kittens that are, having more diarrhea problems. Urine scald is more common in like a bottle baby kitten that has to be stimulated with tissue paper to go potty, but that can kind of cause a rash that you might not identify till the kitten's a little bit older. We do have a fair amount of kittens come in with fleas. We treat them as part of our initial intake processes, whether we see fleas or not. They are treated for them, but they can still have a residual rash even after the fleas have been treated. And that can typically look like a little bit of scabbing along their body. The one thing that we do kind of really keep an eye out for is fungal infections, which is typically what we would refer to as ringworm. It's not a worm. It is just a fungus, sort of equivalent to like athlete's foot, but the type that kittens can get can be contagious to people, and it can cause hair loss in both kittens and in humans. It's typically easily treatable in most areas, but obviously losing your hair in a patch is never an ideal situation. So we try to screen kittens before we send them to foster for any sort of hair loss. But if you notice any hair loss developing in your home, that's certainly a reason you should be seen so that we can screen them for that. Luckily, ringworm in Michigan is not super common compared to many other areas of the country. So we don't get a ton of cases of this every year. So finally, moving on to talk about the benefits of fostering. We wouldn't be able to save the lives of so many kittens without the support of our foster caregivers, and that is why this program is just so near and dear to my heart. It can be so emotionally rewarding to know that you're setting them up to go on to have great lives. We need to make sure, and I'm speaking from personal experience here, that we're pacing ourselves to prevent burnout. Because when we start fostering, it can be such an enjoyable experience, and we can be so passionate about it that we take litter after litter after litter of kittens to try and help as much as possible. But we want to make sure that we're giving ourselves breaks to kind of rest and regenerate in between litters, so that we don't eventually burn ourselves out. We want to remember that saying goodbye is the goal. Sending those kittens up for adoption allows us to make space for more kittens that will need our help in the future. It's not a bad thing if you foster fail, which is what it's referred to when you end up adopting your kitten instead of returning it. If you do decide to adopt your foster, your adoption fee is typically waived for kittens, so that can be a nice benefit. If you're interested in signing up, please visit michiganhumane.org/foster, where that'll ask you to fill out a survey and then be contacted with more information. And if you want to learn more about what's involved about bottle babies and nursing moms, please make sure that you tune in for part 2.